Hi, my name is Annalee Kruger. I am the owner of Care Right Incorporated. We are a virtual family caregiver, senior care, dementia, and end-of-life consultancy, serving families all across the globe virtually. We join in families' journeys wherever they live and wherever they are in their care decisions and caregiver journey. A little bit about me: I used to be a social worker, admissions director, and long-term care executive director for 22 years. And every day I had families in my office because there was a medical crisis. Mom fell, she broke her hip. She's a caregiver to dad with dementia. What do we do? Hospital says, here's a list of care facilities. Go find one by noon tomorrow because we're discharging. And so the families would come into the care community completely overwhelmed, have no idea what their parents have in order, like long-term care insurance, funeral arrangements, end of life, like full code or do not resuscitate, estate documents like power of attorney. Everything was just a mess. And I was spending so much time educating them about dementia progression and why dad is behaving the way he is, and helping them understand assisted living and memory care and skilled nursing and skilled rehab and what are the differences in all of those care levels. And then also doing basically family mediation, because you would hope that the aging process or dementia progression or a medical crisis would bring families together. And I am here to tell you that it does not. So most families, when I would ask them, well, what conversations have you had about aging as a family? And the answers were always, I don't know, we've never talked about anything like this. And here they are in a medical crisis and they have to make really big decisions quickly. And no one ever feels confident in decisions that they have to make when their back is against the wall. I'm also an author of The Invisible Patient, the emotional, financial, and physical toll on family caregivers. I've worked with over 20,000 families across the country in helping them with care decisions, care outcomes, family meetings and family mediation, and care advocacy. So an aging plan, there's actually about 20 different components to an aging plan. So it's a very holistic, comprehensive, well thought out, informed decision-making planning process that I take our clients through. I facilitate their family meetings, find out what's working well, what's not working well. Most of the families, when they come to us, are burned out, overwhelmed, confused, scared family caregivers. Most of them have been thrust into the role of family caregiving or decision making, and they have no idea what they're doing. They're not comfortable with the role that they're in. And there's definitely an emotional and relationship toll on the families when you get thrust into caregiving and you think that you have this whole caregiving thing down. Well, you do until you don't, and then what? We also know that there's a major issue with solo agers. What keeps them up at night is who's going to take care of me when I get old and when I need help. That is every single solo ager I've ever talked to in 30 years. That is what keeps them up at night. When I ask our client, because our client is the whole family, right? So we've got mom and dad, we've got the adult kids and blended families or in-laws, whomever is part of that care team. When I ask the parents, what are your goals as you age? It has always been the same responses. I want to age in place at home and I do not want to be a burden on my kids. But it's pretty much always the adult kids that I'm on the 30-minute free consult Zoom with because they are burned out, they're overwhelmed, and they don't have a lot of grit left. And now their relationships at home are strained, their relationships with their siblings are strained. They assumed that their siblings would help out and they don't. So you can kind of see how this spirals out of control very quickly. And they also feel pretty resentful towards the care recipient. And then they feel guilty for feeling resentful. And so navigating the senior care industry itself, assisted living, memory care, skilled nursing, skilled rehab, hospice, palliative care, adult daycare, home care, just navigating that piece alone is hard and complex for families, let alone also trying to manage their changing roles where the spouse is now the caregiver or the adult son or the adult daughter are now thrust into the role of caregiving. So you can see how overwhelming and complex, and there's a lot of nuances to putting an aging plan in place. So we facilitate family meetings, learn what's working well, what's not working well. What is everybody's understanding of how progressed dad's dementia is? What does the financial picture look like? Because the finances always determine what their care options can be. Families, when they try to navigate this aging, family caregiving, family relationships, blended families, mom had a stroke, dad's demented, what do we do? When they try to do this on their own, they make very expensive mistakes, and there's so much angst that could have all been prevented, and the mistakes that they make could have been prevented had they worked with us in the first place to put an actual thought out comprehensive aging plan in place. Families don't think about, how does this whole navigation of care work? What are the differences in care levels? They don't think about waiting lists in these different care communities. They don't realize that their parent has to qualify in every level to be able to get into different care communities. And they certainly don't think about state surveys and abuse and neglect that's rampant in these care communities, especially since COVID. So how does an aging plan help? What is the value proposition? Neutral third-party family meeting facilitator. Every single day I'm on Zoom with families who are like, well, Annalee, we've tried to have these conversations with our parents and they gave us so much pushback that we quit trying. And I'm like, well, that's because you're family and you're not a professional family meeting facilitator and you're not a family mediator. And even if you were able to have a successful family meeting about the what-whens of aging, if you don't understand how care is paid or all the nuances of senior care, that's great that you started the conversations, but where are you going to go from there if you don't have the information that they need or that you need to be able to actually put your own plan in place? I've yet to work with a family who actually understands dementia progression. And so again, that's part of that aging plan process. Family meetings, help them understand aging, help them understand dementia progression, get the caregivers' lives back on track, because by the time they get referred to us or find us, their family relationships all across the board are incredibly strained. We also help them understand the landscape of senior care and what their care options are for current care needs and future care needs and how much that's going to cost. So then we can reverse engineer and say, okay, well, if you want to age in place at home, what is your age in place at home care budget, so that you don't break the bank, so to speak, and then jeopardize future care community options. Most families stay on our services, our care packages, to then help them implement and oversee and adjust the care plan or the aging plan as needed, and provide ongoing family meetings, ongoing support, ongoing education about dementia. We can't just have a one and done conversation. That's just not adequate when we're putting the aging plan in place, because it's so complicated. Family dynamics, dementia progression, senior care, dad fell again, now what do we do? I'm supposed to be traveling overseas for work, but dad's gonna have surgery, what do we do? You can see how everything just kind of really does spiral out of control quickly. So most families stay on our care package, ongoing services, usually until their loved one passes away. We know that when they don't stay on services, they just don't implement the aging plan. They don't do the 20 or 30 things, whatever it needs to be done. They just don't do it because they're already overwhelmed, and by then mom fell again, and so then they don't get anything done with the aging plan implementation. So when they call back and be like, Annalee, dad fell again or mom had another stroke, I'm like, okay, so how far did you get with implementing the aging plan? And they're like, we didn't touch it because then we had another medical crisis. So really helping these families understand, yes, CareRight does aging planning, comprehensive aging planning, but they also then provide the white glove approach, ongoing support services to just make sure that the family is going to have the best possible outcomes. An aging plan also solves for families making knee-jerk reactions versus thoughtful and informed decisions, whether it's moving them into a care facility that they didn't do any due diligence with, or they make the knee-jerk reaction of moving their parents in with them, and then they're like, oh my gosh, I'm in over my head. I didn't realize what I was getting myself into. So putting a plan in place just helps them make smart, informed, more sustainable decisions. Families make expensive decisions when they think that they know what they know, or they used neighbor Joe's advice, or they Googled what to do. So you can probably understand that that's not going to yield very good outcomes. And in caregiver burnout, again, the aging plan solves for that. Unfortunately, by the time families come to us, they are so overwhelmed and burned out as caregivers that they're pretty angry, they're resentful. That's why 85% of my families, I'm doing family mediation with them. while I'm putting their crisis plan in place. So the tone of family meetings when it's a more proactive family where they're starting to see the writing on the wall is much different than the tone of family meetings when they come to us in crisis and no one's getting along and I'm doing family mediation, and they're just not going to have the best care outcomes, their care options, because they waited until they were in crisis, or they didn't get referred until they were in crisis. Families who quit talking to each other after their parents die, many times that actually could have been prevented. And no parent ever wants their kids to never speak to each other again because of aging or caregiving. Like, no parent ever wants that. But that's what happens a lot of the time when we can't catch these families sooner rather than later. The care matrix prevents families from blindly and randomly touring care communities and wasting 3 or 4 days to then realize that, oh, all these tours that we just did, they don't have openings, or they only have memory care, but mom needs assisted living, and what do we do? Because they're just blindly, randomly touring these care communities. That's why I started my company in the first place. So a care matrix, a community matrix, is part of an aging plan. It's a critical piece of the aging plan and current and future care needs, but it also helps you understand the lay of the land and the state of the union in senior care. It's not great. And it also helps you, just in case you do have to modify the financial plan, it helps you work with real numbers instead of a question mark on, well, how much is care going to cost Bethel and Marvin? So these are just partial clips of the community matrix. This is actually a very labor-intense, done-for-you project that we do for families all across the country. We do about 70 care matrices for families across the country every week. So this is a very much needed, useful planning process that we do so that families and their advisors can make informed decisions. It's robust. The care matrix, the point of that is to help families understand the landscape of senior care, the differences in care levels. So we outline home care options and like home care, adult day care, and like geriatric care managers in the areas that they want us to explore. So if there's a family that has mom and dad, they're snowbirders, they go to Texas and they have a home in New York, we do care matrices for both locations because you never know what's going to happen wherever they are. But then as we have the family meeting, I'll say, well, where does it make sense for them to long-term hang their hat? And a lot of times they want to move closer to where the kids are. So we talk about, okay, what does that look like? Does that make sense? And so then we do a care matrix for where the kids live too. So one family, we could easily have 5 or 6 care matrices depending on what that family situation is. So for us to also provide 5 to 8 different care community options, and we are fee for service. We are not, there's no commissions or anything like that with these care communities. It's just we want families to make informed decisions. And so for us to even get 5 to 8 different care communities as potential options, we have to usually rule out 10 or 15 or sometimes 20 different care communities because either they have a 10-year waiting list, or they don't have memory care, or they were cited for abuse or neglect. And so we rule out the ones, and that's on the not an option tab. So we rule out why we put them on the not an option tab so that families can understand the real landscape of senior care and be like, wow, we need to make smart decisions, because we want to make sure that when we do this touring of these care communities, that we're actually making smart decisions. So this way families understand that this is not just a willy-nilly decision that we make. We have to know all of this data so we can make informed decisions. So it might be 10 or 15 facilities that we have to rule out for various reasons. So then we have what levels of care, like what the care facilities are is across the top, the names of the care facilities, what levels of care they offer. And then down the left side of the matrix is what levels of care do they offer? Do they allow cameras? Do they allow pets? What is the minimum net worth, minimum assets that they have to be able to financially qualify? So then we can at least then reverse engineer and say, okay, well, if you need to have, again, 6 million to be able to financially qualify to get into this different care community, then we can reverse engineer and be like, okay, what is going to be your aging in place at home care budget? Knowing that home care, 24/7 home care for those who do want to age in place at home is roughly $30,000 to $40,000 per aging parent. So a lot of my clients are paying $70,000 and $80,000 a month because they have 2, if not 3 home care workers coming in because that's the type of care that they need because their goal was to age in place at home. That's great if they can afford it, but what's the plan if they can't afford it or just simply lives in a place where there just isn't good care options because they live in a rural area or in the mountains, as an example. So again, all of this dialogue is really important for families to then make informed decisions. So again, we outline what are the different care levels, what's the room size, how much do they charge, what's included, and then we do that for each of the different care levels that the care community offers. Again, this is a side-by-side comparison, and this is actually a very long care matrix spreadsheet. So there's 5 to 8 different care communities, and we walk the families through our findings of the care matrix. So that's just the care matrix. We also have the digital or the electronic grab and go checklist. So that's because, again, when I was an employee, kids had no idea what their parents had in order, or the healthy spouse had no idea what the now ill spouse had done. So they didn't know if there was long-term care insurance, estate documents, they didn't have accounts, passwords, military discharge records. Kids didn't know who the financial planner was for their parents. They didn't know anything. They never met them. They didn't know who their parent's CPA was or attorney. So I created the e-binder, the e-grab and go binder. It's a massive checklist: business succession plan, funeral paperwork, state attorney, any legal documents, account, divorce degrees, any litigation, adoption records, like having everything that families need at their fingertips just for the what whens of aging. Start asking questions if you're not already. Is there anything in your personal life that's impacting your career, your business, your finances, your emotional and physical health, your lifestyle, and your relationships? And they're like, we haven't been able to travel because every time we get ready to go somewhere, dad falls. So this is the reality of what clients are going through. Start asking these types of questions. We don't know what to do with mom and dad. Mom's in the hospital, dad's in rehab. Anything like that that's aging, senior care, dementia, and caregiver related, we offer a free 30-minute consult, and then we can get them scheduled. Other questions: are you a family caregiver? What conversations have you had as a family about the what whens of aging? What challenges may you be having at home? Things like falls, weight loss. Are they having trouble getting to their appointments? Hopefully this was helpful for you. If you are interested, my book, The Invisible Patient, is an actually really good conversation starter that helps break the ice a bit. It's a lot easier to just hand them a book and say, look, we know Annalee. This is how she can help you. If you want to go ahead and schedule a consult and learn more, certainly can schedule that. The sooner that we can help them, the better options that they're going to have. Thank you so much for your time. I really look forward to getting to know you and your families that you work with.